The pectoralis major is a large, fan-shaped muscle located on the front of the chest. Its primary functions include, number 1 is, arm flexion. It helps in bringing the arm forward, such as when you raise your arm in front of you or perform movements like throwing. Number 2 is, arm adduction. It pulls the arm towards the body, which is important for actions like hugging or bringing objects closer to the chest. Number 3 is, medial, internal, rotation of the arm. The pectoralis major rotates the arm inward, which helps with movements such as pushing or turning the arm. Number 4 is, assistance in breathing. When the arms are fixed, such as when holding onto something, the pectoralis major can assist in expanding the chest for deep inhalation. This muscle is vital in a wide range of upper body movements, especially in pushing and lifting activities. The external oblique muscles, located on the sides of the abdomen, play a crucial role in several movements and functions related to the trunk. Their main functions include, number 1 is, trunk rotation. The external obliques are responsible for rotating the trunk to the opposite side. For example, the right external oblique helps rotate the torso to the left, and vice versa. Number 2 is, lateral flexion. They assist in bending the torso sideways, known as lateral flexion. For example, the right external oblique helps in bending the body to the right. Number 3 is, trunk flexion. Along with the rectus abdominis, the external obliques help in flexing the spine, such as when bending forward or performing sit-ups. Number 4 is, compression of the abdomen. The external obliques help compress the abdominal contents, playing a role in stabilizing the core and assisting in actions like forced exhalation, coughing, and heavy lifting. Number 5 is, posture and core stability. These muscles help maintain posture and provide stability to the core, which is essential for balance and proper movement during physical activities. Overall, the external oblique muscles are vital for core strength, stability, and movement of the torso in various directions. The rectus abdominis, commonly known as the abs, is a long, flat muscle that runs vertically along the front of the abdomen. Its primary functions include, number 1 is, trunk flexion. The rectus abdominis is responsible for flexing the spine, allowing you to bend forward, such as when performing sit-ups or crunches. Number 2 is, stabilization of the core. It helps stabilize the pelvis and lower back, providing core stability during physical activities like lifting, running, or maintaining posture. Number 3 is, compression of abdominal contents. This muscle assists in compressing the abdominal cavity, which is important for breathing, especially exhalation, coughing, and actions that require abdominal pressure, like lifting heavy objects or defecation. Number 4 is, postural support. The rectus abdominis helps maintain an upright posture by balancing the forces between the spine and pelvis. This muscle plays a key role in core strength, stability, and movement, making it important for everyday activities and physical exercise. The latissimus dorsi is a large, broad muscle that covers much of the lower back and sides. It plays a key role in various movements of the upper body, particularly those involving the arms. Its primary functions include, number 1 is, arm extension. The latissimus dorsi helps extend the arm backward, such as when pulling something towards the body or reaching behind you. Number 2 is, arm adduction. It brings the arm down toward the body from a raised position, as seen in movements like pulling down on a bar or bringing the arms inward during a swim stroke. Number 3 is, medial, internal, rotation of the arm. The muscle rotates the arm inward, such as when turning the palm of your hand toward your body or performing actions like throwing. Number 4 is, assisting in breathing. In certain situations, such as heavy breathing during exercise, the latissimus dorsi helps expand the chest by raising the ribs, assisting with inhalation. Number 5 is, stabilization of the spine and pelvis. The latissimus dorsi provides support to the lower back and pelvis during lifting, pulling, and other weight-bearing activities. Overall, the latissimus dorsi is crucial for pulling, lifting, and rotating the arms, and it contributes to upper body strength and stability. The trapezius muscle is a large, triangular muscle that extends along the upper back and neck. It plays a key role in shoulder and neck movement as well as posture. Its functions include, number 1 is, elevation of the scapula. The upper part of the trapezius helps lift the shoulders, such as in a shrugging motion. Number 2 is, depression of the scapula. The lower part of the trapezius pulls the scapula down, assisting in movements like pulling the shoulders downward after a shrug. Number 3 is retraction of the scapula. The middle part of the trapezius helps pull the scapulae, shoulder blades, toward the spine, which is important in movements like rowing. Number 4 is upward rotation of the scapula. The trapezius works with the serratus anterior to rotate the scapula upward, a movement crucial for raising the arms overhead. Number 5 is neck extension and lateral flexion. The trapezius helps extend the neck backward and allows for tilting the head to the side. Number 6 is postural support. The trapezius helps maintain proper posture by stabilizing the scapulae and supporting the spine and shoulders. Overall, the trapezius muscle is essential for shoulder mobility, upper body strength, and maintaining posture. The scapular muscles refer to a group of muscles that are responsible for the movement, stabilization, and support of the scapula, shoulder blade. Key functions of the scapular muscles include: Number 1 is scapular stabilization. These muscles help stabilize the scapula against the thoracic wall, ribcage, allowing the arm to move efficiently. Number 2 is elevation of the scapula. Muscles like the levator scapulae elevate the scapula, raising the shoulders, such as in a shrugging motion. Number 3 is retraction, adduction, of the scapula. The rhomboid major and minor pull the scapula towards the spine, retracting the shoulder blades, which is important in pulling movements like rowing.